raised the questions. From 0 o'clock to 24 o'clock, June 24th, newly increased local confirmed cases are 13, and no increase of suspected cases or asymptomatic carriers. From June the 11th, the outbreak of a Xinfadi market, Beijing has accumulatedly reported 269 confirmed cases. All of them are now in hospital. And asymptomatic carriers are 22 who are under observation. Today is the Dragon Boat Festival, and the Dragon Boat Festival holiday happens to be at a critical moment of COVID-19 prevention and control. We cannot lose up our guards or efforts for the epidemic control. We must remain vigilant and stay alert against the COVID-19 spread, strictly implement the control measures, and guard against the risk of a virus. We might lose up our mind, but not the protection and precautions. We must consolidate and further expand the hard-won achievements of COVID-19 prevention and control over the past 14 days. The capital epidemic prevention and control requires that we must have a closely weaved network against the virus. Where is the virus? Where is our efforts will be. And wherever we are, our protection will be in place. We must have four earlies, that is early detection and quarantine and treatment and report, and ensure everyone fulfills their responsibility, focus on the key areas and key links to make sure that no possible transmission point will be left out, and to do our work in advance before the virus spread. And we will win this hard fight and battle against the Xinfadi outbreak. Nucleic acid testing is one of the best science-based ways to detect infection, and it's also a guarantee of us to ensure regular control. We must ensure that everyone who should be tested are tested. We will leave no one suspected of contracting the virus out. We strengthen epidemiological study and strengthen the analysis of the connection of cases and leave no clues out. Our citizens must defend their own health. If you have shown symptoms, please seek medical attention immediately and do not delay treatment. To treat our patients is one of the most important tasks facing us right now, and our work is racing against time. We must pool the best medical resources, strengthen expert consultation, and use intensive care and the combination of Chinese and Western medicine, and deliver personalized treatment plans for each patient. We will never give up on any of the patients. For the past 5 months, we have gone through a lot during the epidemic control, and we've felt new enlightenments towards our health and life. We will voluntarily strengthen the epidemic control measures and put it into action. The Dragon Boat Festival has a long history, more than 1,000 years of tradition. And this year, some of the offline activities cannot be held as usual, but this will not affect our festive atmosphere, but rather it has given us the opportunity to feel deeper the praying for peace and the importance of peace. And our citizens will abide by the rules and actively cooperate with Beijing's relevant epidemic control initiatives and measures. Do not leave Beijing unless necessary. Wear masks, avoid parties and gatherings, wash your hands frequently, and through the hard work of personal protection and watch each other's back and tide over difficulties together, we will uphold the strong culture and value of the Dragon Boat Festival and have a safe and sound festival holiday together. And today we have invited representatives from Beijing Municipal Information and Economy Bureau, Beijing Public Security Bureau, Beijing Municipal Health Commission, Beijing CDC, and Peking University First Hospital to this press conference. They will give us the latest release of relevant information. Next, I'd like to introduce you the speakers. They are Deputy Director General, Beijing Municipal Bureau of Economy and Information Technology, Pan Feng, Deputy Director General, Public Security Bureau and the spokesperson of Pan Xuhong, and spokesperson of Beijing Municipal Health Commission, Gao Xiaojun, and Deputy Director General of Beijing CDC, Mrs. Pang Xinhuo, and an expert of the National COVID-19 Control Team, and also the Chief Infection Department of Peking University First Hospital. First, let's give the floor to Mrs. Pang Xinhuo. She will brief you about the latest confirmed cases and epidemiological studies.
Dear media friends, good afternoon. Now I'd like to report the newly reported cases on June 24th. On June 24th, from 0:00 to 24 o'clock, we have seen 13 newly reported cases, among which there were 5 men and 8 female. The average age is 42 years old, and the youngest one is 18 years old, and the oldest one is 60 years old. According to the localities, there are 9 cases in Fengtai districts and 4 cases in Daxing districts. Now I'd like to brief you on the latest information on the cases. The first case is a female who is 29 years old. She lives in the Lugouxiang County of Fengtai district and lives in the Wanquan Shengjing residential community on the 9th Liuchun Road. She went to the Xinfadi wholesale market to buy foods and began quarantine at home from June 14th, and she tested positive on June 21st for the throat swab. And on June 22nd, she was transferred to the traditional Chinese medicine and Western medicine hospital in Beijing. And she was diagnosed as the ordinary patient on 24th. The second case is a man who is 29 years old. He lives in the Lunjingcheng and in the Fengtai district. He works at the Xinfadi wholesale market. And according to his statement, he suffered from a sore throat on June 13th, and his symptoms declined after taking medication, and he tested negative on June 14th. Because many people who live with him tested positive, he began home quarantine on June 16th. On June 22nd, he subjected to nucleic acid test on the quarantine sites, and he tested positive on June 23rd. Then he was transferred to the hospital in Fengtai district by the ambulance, and on June 24th, he was confirmed to be a confirmed case. The third case is a female who is 57 years old. She lives in the Guogongzhuang residential community in Fengtai district. She has retired, and she went to the Xinfadi wholesale market on June 10th to buy products, and on June 16th, she went to the Fengtai district to shop, and she stayed at home from June 17th to 20th. She once shopped in local market twice and gave hairdressing services to 2 residential community staff on June 21st, and she tested positive on 22nd. Then she was transferred to the hospital in Fengtai district by the ambulance, and she was confirmed on June 24th, and she was confirmed as an ordinary patient. The fourth patient is a man who is 46 years old. He lives in the Furong Road of Fengtai district, who is a worker in the Xinfadi wholesale market. He began home quarantine on June 13th and began quarantine at designated places at June 17th. And on June 22nd, he was subjected to the nucleic acid test and tested positive. Then he was sent to the hospital in Fengtai district by the ambulance. And on June 24th, he was confirmed with mild symptoms. The fifth patient is a woman who is 26 years old. She lives in the Yilan residential community in Fengtai district, and she works for the Xinfadi wholesale market. She began suffering from headache, sore throat, and other symptoms on June 12th, and she began home quarantine. And she and her family were transferred to the quarantine sites on June 15th, and on June 22nd, she was tested positive and was sent to the Fengtai District Hospital by the ambulance. And on June 23rd, he was transferred to Ditan Hospital by the ambulance, and on June 24th, she tested positive in the nucleic acid test and with ordinary symptoms. The sixth case is a woman who is 60 years old. She lives in the Huaxiang Yilan residential community in Fengtai district. And she works in the wholesale center. On June 15th, she began quarantine, and on the 21st, she tested positive and sent to the hospital on June 22nd. On June 23rd, she was transferred to the Ditan hospital, and on 24th, she tested positive and was confirmed as the COVID-19 patient. The seventh case is a woman who is 42 years old. She lives in the Nanyuan North Road in Fengtai district. She works in the Xinfadi market and is a staff for the market. She began quarantine on June 13th, and on 21st, she began suffering from fever, nausea, and stomachache and other symptoms. She didn't have the symptoms of phlegm, cough, sore throat, and shortness of breath. On June 23rd, she tested positive and transferred to the Fengtai hospital by the ambulance, and on June 24th, she was confirmed as the COVID-19 patient. The eighth patient is a man who is 39 years old. He lives in the Tianlongjin market in the Fengtai district, and he works for the Xinfadi market. He was a self-employed person. He began suffering from symptoms such as dizziness, fatigue, and fever. On June 21st, he was transferred to the Fengtai hospital for treatment, and on June 23rd, he tested positive and was confirmed with severe symptoms on June 24th. The ninth case is a woman who is 44 years old. She works for the Xinfadi wholesale market. She is a salesperson for the market and began quarantine at designated places. Her husband was diagnosed and confirmed on June 15th, and on 22nd, she showed symptoms of fever and transferred to the Fengtai hospital by the ambulance, and on June 24th, she was confirmed with typical symptoms. The 10th case is a woman who is 18 years old. She lives in the Daxing district and the Lucheng West Road. She is jobless, and she once went shopping in the Xinfadi wholesale market. She was mainly living in her parents' homes before quarantine and had close contact with parents and friends. And during that period, she went to buy breakfast and have meals on the restaurant and went shopping in nearby shops. And on June 22nd, she was confirmed as the close contact and was transferred to the quarantine sites and was subject to throat swab test. And on June 23rd, she tested positive and designated and transferred to the Renmin Hospital in Daxing district and was confirmed on June 24th. The 11th case is a man who is 55 years old. He lives in the Daxing district, Xihongmen town. He is jobless, and on June 16th, he self-drove to Xihongmen town to visit his father. On June 17th, he went to the foot massage shop and treat minor injuries in nearby residential community. And on June 19th, she was confirmed as the close contact and was transferred to designated quarantine sites. And on 23rd, he tested positive and was confirmed on June 24th with typical symptoms. The 12th case is a man who is 38 years old. He lives in Weishanzhuang Township in Daxing District. He works in the Xie Xiaochu restaurant in Haidian District. He is the manager and the salesperson of the restaurant. He once went shopping in the Xinfadi wholesale market, and he mainly conducted activities in the residential community and workplaces. On 15th, she drove to Jubaoyuan, a catering company, to shop, and on 16th, he and his son went to Daxing Hospital to see a doctor, and on 19th, he began fever, and on 23rd, he was diagnosed in the Daxing Renmin Hospital and tested positive. On June 24th, he was confirmed as COVID-19 patient. The 13th case is a woman who is 60 years old. She lives in Guanyinsi Road in Daxing District. She has retired and went shopping on Xinfadi Wholesale Market on June 3rd. On June 14th, as the close contact, she began quarantine at designated places. On June 16th, she began fever and then was transferred to Daxing Renmin Hospital by the ambulance. From June 15th to 22nd, she subjected to 4 times of throat swab and tested negative. On June 23rd, another nucleic acid test tested positive, and on June 24th, she was confirmed as COVID-19 patient. Now I would like to add another case who is confirmed on June 23rd. It is a man who is 50 years old who lives in the Xihongyuan residential community in Fengtai district. He works for the Hebei Zhuozhou Taoshu Food Corporation. He is a driver and a loader, and he took deliveries in the Xinfadi wholesale market every day. On June 14th, he participated in the nucleic acid test, and on June 16th, he was confirmed as the close contact of the asymptomatic patient, and then was transferred for quarantine. On that day, he was given the result of the positive test result, and then he was subjected to another nucleic acid test. On June 18th, he was confirmed to be positive and then transferred to the Fengtai Hospital by the ambulance. Because he has never shown fever and other symptoms, on June 21st, he was confirmed as asymptomatic patient and transferred to the Beijing Hospital by the ambulance. On June 23rd, he was confirmed as COVID-19 patient. Dear citizens and friends, I would like to remind you that during the Dragon Boat Festival, we should not slacken our efforts and lower our guard. We should wear masks, wash hands frequently, do not participate in mass gatherings, and maintain social distancing and other good habits. Do not leave Beijing until absolutely necessary, and stay at home to reduce unnecessary trips. If you go to trips or other scenic spots, you should make advance appointments and cooperate with temperature checking and health code checking. Watch the diet hygiene and refrain from eating raw food and semi-raw food, and refrain from participating in mass gatherings. And we should still be on high alert and vigilant. We should remain committed to the social distancing rules and take actions. Then we will consolidate the achievements. Thank you.
Thank you, Mrs. Pang. Next, let's give the floor to the Deputy Director General, Beijing Municipal Information and Economy, and he will review about the 3.0 version of the health kit. Friends from the media, good afternoon. Next, I'd like to give you a briefing on the 3.0 version of the health kit, also known as 健康宝. First, we have added a new feature by scanning a QR code. You can have electronic registration. We've always adopted the policy of minimize the collection of data, streamline design, and multi-department coordination and high protection of the data. We do not voluntarily collect personal location information, but rather we analyze the data from different sources and give each other's health conditions. And this time we upgrade the mini app, and you use the QR code scanning function. You can use it in communities, office buildings, restaurants, and parks and scenic spots. To be specific, each place can designate a personnel as a registrar, and the registrar can fill in the information of the affiliated organization and then apply for a QR code, put it up on a poster, and when visitors come, they can just scan the QR code and then register online. And when the visitors scan the code, the status of this visitor will be shown immediately, and when abnormal conditions happen, the scanning of the code will show abnormal conditions and with an alarming sound of the ambulance. And the registrar can also check the information of the visitors in real time or file it in a record for further verification and management, or delete the whole registry when necessary. And only someone with a green code or with no abnormal condition can apply to become a registrar. And when the registrar became having condition of abnormal conditions or act against laws or regulations, the registry will become invalid immediately. This new feature replaced the traditional paper-based registration and combined verification of the health code and registration, and reduced the prevention and control pressure and avoid contact infection. And for places with large volume of visitors, we advise to designate more than one registrar and QR code bars, and keep 1 meter distance, and put up the QR code, avoid gathering. To protect personal privacy, your information will be shown partially hidden. Only your surname and the first two and the last two digits of your ID numbers will be shown, and the full information will be uploaded to the municipal cloud, and it will only be used for tracing sources of relevant COVID-19 cases. Second, based on the application scenario, we'll further improve our functions. So far, we have 29 million people searching their health data, 360 million. And about 340 people have their QR code applied, and about 5 million people have scanned the QR code. And based on the previously reflected problems, such as young people using their photo and the national data verification and so forth, we have further improved our 3.0 version of the health kit. First, young people under the age of 16, we do not have compulsory facial recognition, but rather we use photos only, and it will be tagged as underage and with no facial recognition. And second, we simplified the procedure for changing your photo. You just press the photo area for 3 seconds, and then you can retake the photo. Third, we improved our national data verification feature, and at the bottom and the top of the mini app, we add notification and the comment column for the communication. Recently, many parks, banks, supermarkets have adopted very people-oriented solutions to help others check their status and solve the problem of old age people's difficulties of using the app. And some of them have reported problem of incomplete pages of the mini app. You can update your WeChat to solve the problems. And so far, since the Xinfa market outbreak, so there are many regions and neighborhoods in Beijing has been identified as a medium or high-risk area. In order to protect our residents' health and life, our medical staff and community staff and nucleic acid testing staff have delivered door-to-door screening and deliver targeted measures to detect key people. And we have, in a timely manner, adjusted health data on the health kit and address the key concerns of our residents. If your health status on health kit has been changed into red, it means you or one of the confirmed suspected close contact or asymptomatic carrier cases. Please fulfill your obligation of observation in designated facilities. If you have problems, please contact Beijing Municipal CDC. If you have a yellow code, it means through the screening of this community, you've been visiting Xinfadi Market or other key areas, and you must be put under home observation. And please follow these regulations and contact your community if you have any problems. And if there's a notice came out on your screen, it means probably you have a travel history outside Beijing. Please press continue, and then you'll reach the national platform of data to further verify your data. Another possibility is that you have a history of visiting medium or high-risk areas such as the Xinfadi Market. Please reach out to your community or relevant competent authorities to fulfill your obligation of COVID-19 control. I'd like to remind you that the capital's epidemic control work is of great importance, and we must abide by the national laws and Beijing municipal regulations, and any reporting or lying will be held legally accountable. Beijing Health Kit assures everyone's health. Please use the mini app, and all the companies and organizations resumed work and production should use the QR code scanning and to replace the paper-based registration. It cuts transmission and better for tracing and protects personal privacy. If you have any advice during your use of the mini app, please give us a feedback. We'll keep improving our service quality. And today is the Dragon Boat Festival. Please do not leave the city unless necessary and use science to protect us. I believe that we'll win this battle against COVID-19. Thank you.
Now, let's welcome the Deputy Director General of the Public Security Bureau to notify us on the illegal activities in the prevention and control efforts. Dear friends from the media, good afternoon. Enhancing nucleic acid test and make sure all the people are tested and all the people who are willing to test can be tested. And this is a very important part to implement early reporting, early identification, early quarantine, early treatment. In order to control and prevent the virus and curb the spread of COVID-19, Beijing has stipulated that do not leave Beijing unless absolutely necessary. And if you have to leave Beijing, you have to show negative nucleic acid test no older than 7 days. Some people have found the so-called business opportunities during this period. They claim they can fast-track the testing procedures and profit from this illegal activity, which has hampered the orderly procedure of nucleic acid test. In recent days, the Beijing police have identified and dealt with these kinds of cases. Now I'd like to brief you on this. On June 23rd, the police received reports from the general public. A user on Weibo posts that he wants to sell the quota for nucleic acid test, and he can provide the test results within 24 hours and 48 hours. The price is 1,780 RMB. After receiving the report, the police worked overnight and swiftly identified the suspect. He is a man who is 23 years old, who is termed Yan, and his accomplice, termed Bai, who is 24 years old, is also arrested. After in-depth investigation, Bai is a worker for a bar, and the manager, Wan, who is 37 years old, organized the subordinates to set up the WeChat nucleic acid test group chat, and they spread rumor and information online to appeal to and attract clients to claim that they can give swift test results. After markup and price gouging, they have introduced the general public to conduct nucleic acid tests in relevant organizations, and they profited 50 to 2,000 yuan from this process. The police have arrested 9 people, and Yan and other 4 people have been in police custody, and other people and cases related to this have been under investigation. Now, with the concerted efforts of the whole city, the prevention and control work of Beijing has made great progress, but the situation is still very severe and complex. We cannot lower our guard. The illegal activities undermine people's interests and disrupt our prevention and control work. For this, the Beijing police have been cracking down on these irregularities. Since June 19th, our bureau publicized the typical cases related to the rumors of COVID-19 prevention control. We have dealt with 14 cases and arrested 10 criminal suspects. For example, recently, a netizen posted information that one confirmed case was identified in Wangfujing shopping store, and all the people in the building should be subject to nucleic acid test. According to our investigation, the netizen who is named Fan has spreaded the rumor and spreaded the misinformation, which has seriously interrupted the public order. Another example is a man who is surnamed Jiang, who works for a company. In order to draw attention, he said to his colleagues that he tested positive for nucleic acid test, which created panic in the company, and the staff called the police. The above-mentioned 2 people have been dealt with and in police custody. Now our nuclear testing capability has been enhanced. The major people, major regions, and major areas have all been subjected to nucleic acid test. We hope the citizens can participate in the test through regular and legal channels, and to make sure the resources are used in major links in cutting the spread of the epidemic. We hope we can remain sober and do not believe in and create and spread rumors to safeguard the hard-won achievements. Thank you.
Thank you so much for your briefing. Next, let's leave the time to journalists, and please state your agency before you raise any questions. Our first question, please. Hello, I'm from Kazakhstan, a national news agency. Our capital city is a sister city of Beijing, and Beijing has accumulated great experience in combating COVID-19. And my question is, how would you like to share this information with other big cities, including Nur-Sultan? I'm from Kazakhstan, and as you know, our capital city is a sister city of Beijing Municipality, and we also know that Beijing has accumulated rich experience in fighting against COVID-19. So my question is, how would Beijing like to share this information and experience with other big cities in Kazakhstan, including its sister city? Thank you. Thank you for your question. Kazakhstan is a close neighbor of China. To co-build a community of shared future of mankind's health is a common goal of all of us. Currently, COVID-19 is spreading across the globe, and there are still a lot of things we do not know about the virus. And we still have a lot of work to do in terms of the study. At the same time, we should see that COVID-19 is testing each country's governance capability and system. Beijing's epidemic control is ongoing. You raised a question about how would Beijing share its own experience. I think it's so early to say, but it is true that there are several practices of Beijing that I'd like to introduce to you. First, we will fully implement the CPC Central Committee's decision and plans of COVID-19 control. Since the outbreak earlier this year, President Xi Jinping visited Beijing in person twice, gave his instructions and plans, and be the commander for us, and lead us through the people's war against the virus. And Beijing Municipality has been following the CPC Central Committee and the State Council, established a system and a work team for combating the virus. And we set the right level of public health emergency response. We've always prioritized the people's health and life. We've always make sure we properly implement the major decisions of the Central Committee's decision and coordinate each department to ensure proper organization against the virus. And second, we make sure each party should play their own role and make sure they fulfill their own responsibilities. As you know, the local authority, each department, the employers and organizations, and the people, individual people, the four parties, should all fulfill their own responsibility. As early as January the 24th, we issued the circular about this, what we call the four-party responsibility. We advocate that the whole society should participate in COVID-19 control so that everybody should be a part of it. We organize our citizens to devote themselves in the fight against the COVID-19, and we deliver a strong synergy together. Third, we coordinate efforts to promote both epidemic control and economic development. We implement the Central Committee's decision. We will make epidemic control a regular part of our work, and we prevent the spread of the virus from both without and within. We will make sure there are no loopholes and do not lose up the guards and prevent from resurgence. And we implement early detection, early report, regulation, and treatment. And we are strictly implementing those measures to make sure we deliver targeted control, rapid treatment, and rapid disposal and handling of the cases. And based on experts' opinion, on April the 30th, we raised the public health emergency level to level 2 and promoted the resumption of work and production. And then, on June the 6th, we lowered the public health emergency level to level 3 and further resumed people's life and production. And people's lives are gradually turning into something more like a usual. But then after June the 11th, the Xinfadi outbreak, to adapt to the new situation, on June the 16th, we further raised the public health emergency response level to level 2 again. And as of June the 24th midnight, the total confirmed cases of a Xinfadi outbreak were 269. Just now, Madam Pang Xinhuo also give you all the information about the latest cases. And all of those 269 patients are under treatment in Beijing Ditan Hospital. By doing so, we reduce to the minimum level the influence on people's life, and to ensure market supply and prices. Fourth, we strengthen public health emergency management system. The epidemic has gone global. It means that all countries must enhance their capability of dealing with emergency public health incidents, especially the infectious disease. And in this process, we will analyze our shortcomings and weak links in public health emergency response and make improvements accordingly. On May the 19th, the Municipal CPC Committee issued the opinions on strengthening the capital's public health emergency management. And on June 4th, the Municipal Government and CPC Committee issued a 3-year action plan that is from 2020 to 2022, the action plan for strengthening the capital's public health emergency plan. And to make sure we deliver all the tasks set out, the 40 tasks set out by 2020. I believe that through these measures, we will further improve our public health emergency response management to a higher level and make our capital healthier and safer. Fifth, we'll further spread knowledge about the COVID-19 control. As we all know, there are 3 measures to contain the virus. First, control the source of infection. Second, cut the transmission methods. Third, protect the vulnerable group. By different transmission platforms, we have been spreading and popularizing the knowledge about COVID-19 control so that everyone knows how to protect themselves. We have issued in succession a total of 86 guidance of health protection. And as of today, we have held 132 press conferences. And these press conferences is also one of the ways and platforms for us to popularize knowledge on COVID-19 control. And also we've been stressing not just us, but community staff and medical experts. We've been stressing the importance of wearing masks, wash your hands frequently, keep your rooms ventilated, and avoid parties and gatherings. I believe these have all improved our people's precautions and awareness. To do a good job in containing the virus in Beijing, we cannot do it without the firm leadership of the Central Committee or without the support of the whole nation or the joint efforts of all citizens of the capital or the mutual help with other friendly cities internationally like Kazakhstan. Just like President Xi Jinping on March 24th in the telephone call with President Tokayev of Kazakhstan, he said, virus respects no border or race. Only by unity can we prevail over the virus. Thank you.
Now please continue the Q&A session. Thank you very much. I'm from the Phoenix. My question is about nucleic acid test. I want to ask you a question. Now the Beijing municipality has expanded the scope of nucleic acid test. Why do we have to conduct the test? And what effect does it have on prevention and control? Thank you for your question. This question I would like to ask the nuclear pneumonia task force, the first hospital of Peking University representative to answer your question. Thank you for your question. First of all, we know that we have been emphasizing early detection, early reporting, early quarantine, and early treatment. Only through these early detecting measures can we prevent and control the spread of the virus. And the most important part of this process is nucleic acid test. We know that nuclei is an important part of virus, and if we identify it, we know that it is spreading in the body. So nucleic acid test is an important measure to detect the virus. If we can't conduct it timely, we cannot swiftly identify the source of the transmission, and we can't quarantine the related cases which will spread the virus. Likewise, if we cannot timely conduct nucleic acid test, we cannot swiftly treat the patients, and it may increase the severe cases and increase the mortality rate. So the most important measure of this prevention and control measures is the nucleic acid test. And in this period, we emphasized the capacity to conduct nucleic acid test. We test all the people who want to get tested. And on this basis, the Beijing municipality has enhanced relevant measures for people at high risk. We also conduct tests on them and expanded the scope and coverage of our nucleic acid test, including people who are related to the Xinfadi wholesale market and who have been to this market, the susceptible residential communities and townships which are at high risk, and staff who are working for the catering industry, and other staff, including people who work for the express delivery, the takeaway food and shopping markets, and also including all the medical staff. Previously, we emphasized healthcare workers on the front line, but now we test all the medical staff. At the same time, we also tested people who have close contacts with people, such as people who are working for banks and windows. So through this large-scale testing, it is very conducive to prevent and control the epidemic. We say that Beijing is taking these measures to implement the philosophy of safeguard people's life and health at all costs. It is our guiding principle. Yesterday, on the press conference, the Director General of the National Health Commission, Mr. Li Haichao, publicized the relevant data. Among the 256 confirmed cases, 137 cases were identified by nucleic acid test. So over half of the cases were identified in this way. Were it not for the nucleic acid test, these patients may have been missed because they didn't go to the hospital and they didn't have close contacts with the patients. So they are the potential spreaders of the virus. So we learned from this lesson in the beginning of the Wuhan virus outbreak. Because of the limited capacity, many cases were caused by community and human-to-human transmission. So this time, Beijing enhanced nucleic acid testing capacity. So we can see that the epidemic has been effectively contained. So nucleic acid testing is very important. But there is also the problem of false negative possibility. So for the people who tested negative, we cannot lower our guard. In the fever clinics, Beijing has adopted the 1+3 pattern, which is nucleic acid test plus serology test and blood test and immunology test, which is to increase the accuracy of the test and to leave no one behind, so as to contain the epidemic. So through these measures, we can see that Beijing is taking measures to contain the virus. So people should cooperate with nucleic acid test. Only in this way can we swiftly and effectively contain the virus and resume normal life and production. Thank you.
Thank you. With Beijing News Network, My question also goes to the Chief Infection Department of Peking University First Hospital, because many of the citizens are concerned whether it is safe to use seafood and fresh water fishes and meat. Is it how to safely dispose of those food? It's a topic of great concern by residents, because many people are afraid of eating seafood or meat, afraid of getting infected through this way. I believe that Xinfadi market is one of the most important places for the outbreak, but so far, all those meat, eggs, and seafood supplied in the regular supermarket are all safe. You can just go shopping and to consume. It's safe to do so. And currently, the transmission is only by droplets, close contacts, or in a very closed-off spaces. It's possible to have aerosol transmission. There's no evidence indicating that intestinal tracts can be another way of infection. And the intestinal tract infection can be of a very low possibility, but you have to pay attention to hygiene when you are dealing with those meat and seafood. Not just be wary about COVID-19, but also other infectious diseases, because the weather is really hot nowadays. It's very easy for germs and bacteria to grow. You need to clean the food and keep hand hygiene. Keep your raw food away from the cooked food, and your chopping boards, your knives, and utensils, keeping the food should all be separated between the raw and the cooked. Otherwise, the hot dishes and the cold dishes, if they are mixed together, they might contaminate each other. While you are eating the cold dish, you might contract some of the intestinal tract diseases. So I like to stress the importance of separating the raw and the cooked, and it's better if we eat cooked food all the time to avoid raw food, because raw food has potential for not just the COVID-19 but other infectious diseases. And use public chopsticks and a separate set of chopsticks for eating as well to keep a good habit. Thank you. That's all for all questions. Beijing's Municipal Press Conference of COVID-19 control is released by the Information Office of Beijing Municipality, and Qianlong.com, eBeijing, Beijing Daily, Xinjingbao, and Beijing News Daily, Tingting FM, Beijing Time, People.com, and People's Video, and Xinhua News Agency, the video link, Xinhua News Agency Beijing Channel, and CCTV Financial, China Daily Network, and Beijing Network, Media Network, and the Beijing Newscasting Company will all be live streaming this. Thank you, all the staff, and that's the end of today's press conference.